What is up, YouTube? Today, we're going to be talking about the medical records administrator, the administrator or the manager, the one who can ensure that the functions that need to be in your medical records actually show up on your medical facilities paperwork. And what do I mean by that? We're talking about codes and other items so that they can be billed for. In medical records, I'm going to show you when you get a patient's chart and you perform an encounter or the patient has an office visit, a super bill is then created. This super bill over to the right hand side are all of the procedure codes that doctor's office can perform. So, in order for that doctor to bill for those procedures, they need to be on his super bill. So, a lot of the administrator duties do involve adding some codes to the database, training in some of those areas of compliance, or adding some codes that the doctor will be needing so that he could bill for those particular procedures. Some of those procedures the doctor can bill for are office visits, as you see here, any labs that are performed in the doctor's office, any injections, pulmonary function testing, or any types of therapy or procedures that may be performed right in the doctor's office. Remember, the super bill is going to have all of those procedures listed so that the doctor can select them and then they can be billed for so the doctor can pay. So, whereas the medical records person may just have to select these, the administrator has to make sure that these codes, these procedure codes for office visits or evaluations, for labs or any test that they perform in their facility appears on their super bill as you see to the right, so they can then appear on the bill so they can be billed out. So I am going to show you how to work as an administrator to add those codes to the system so that they do appear on our super bill so our doctor can bill for those procedures. Usually you'll find those functions in the administration menu, which makes sense since many of these jobs are called medical records administrator or medical records manager. So you're going to make sure those codes can appear by going to the administration tab down to super bill form. Once you get to the super bill form, you will see different sections like evaluation, labs, injections, and the types of codes that the doctor uses in his office for these procedures. So you will get a list of these from the administration, from the compliance team, and your job as an administrator will be to fill them in. I'm going to give you an example of what this is like. So, as an administrator, you may get a document similar to this about COVID-19 or about a new medical condition that you're dealing with. Maybe you'll get one for monkeypox or chickenpox, a new type of the flu, or a new type of virus that is going around. So we have software that can code this information, definitely. But if the software is not up to date along with the codes, an administrator will have to put the codes in. Now, this is very common. Software is not created brand new every day. And literally every day, the compliance team will meet with the Department of Health and Human Services or get some sort of guidance from the CDC for the Centers for Disease Control or from CMS, from Medicare or Medicaid about new codes. So those new codes then come into the office through compliance and they hand them to the different administrators that are responsible in their departments for entering the information into the computer. So as you see here, we have some codes for ICD-10-CM, meaning our diagnosis codes that may be newer that need to be updated in our EHR system. We also have some new procedure codes here that may also need to be updated in the system. Remember, our primary codes that we're concerned with appearing on our Superbill are those procedure codes, those CPT codes, or those codes that the doctor will use and he's able to bill for in the doctor's office. So we see here online digital E&M, which is an evaluation and management code. Evaluation and management is a doctor's office visit or a face-to-face visit with the doctor. As we understand with the pandemic and things that have changed medically recently, we have gotten some new codes that appear here. Right now, we see a code online digital E&M, and this is a 99421 code for a digital E&M. Remember, evaluation and management is for office visits, so you'll need to make sure you put these evaluation and management codes in the right section in our administrative menu. So we see here 99421 is for a digital online E&M exam for 5 to 10 minutes. If it's a longer exam for 11 or 21 minutes, 21 minutes or more, you have a different code. So these are the codes your compliance team has said, these are new codes we need to appear on our Superbill. We are working on software so we can update our software so our codes can be automatic. But because that lag time between getting new software and updates and research can take some time, we need medical records administrators as soon as we get this word from the CDC or from Medicare CMS, we have to make sure we enter this information for compliance reasons. So we're going to go and enter these codes so they can appear on our Superbill. And when they appear on our Superbill, our doctor will be able to bill for those procedures. So now, as you see on our screen, we are going to be going up to our administration tab, and we are going to go down to Superbill form. For our evaluation codes, we have a digital evaluation that we need to put in, and we will put in digital E&M as it is spelled out on our form from our compliance team. And you might need to write which ones are 5 to 10 minutes. As you see here, I have written digital 99421, digital E&M 5 to 10 minutes. Then I'm going to select done. Once I select done, you will not see anything right away because you will need to check the Superbill to see if this code appears on your patient's Superbill. So we are going to go and just open up a patient's chart to see if when we activate any Superbill, are we going to see the patient's information there? Are we going to see that code on our Superbill? The fastest way to check to see is to go into an encounter of a patient who has an encounter already, and you're going to select the edit button at the bottom right. You're just going to select done and save and edit routing slip. When you do the save and edit routing slip, the routing slip will open, and on the right-hand side of the routing slip will be the Superbill. The routing slip is the slip that routes to billing from all of the information we select from the Superbill. So if I select that digital E&M exam that I entered in so that it could appear on my Superbill, now my doctor can bill for it, and it will be sent through routing to billing. If we did not enter that code under the administration tab, the doctor would not be able to get paid because it is not on his Superbill. So make sure for that particular function, you understand that when you're adding stuff to the administration database, that you are effectively adding it to all of the forms in the doctor's office. So the administrative job in adding to this Superbill function will add all of the labs and all of the procedures that you need to enter. So for right now, I'm just gonna add 0000, and I'm gonna type in monkeypox, and you will see that that information will save on a Superbill, regardless of what patient I'm opening. So I'm going to open Get Chart, go to an encounter, edit the encounter. I'm going to select done and save and edit routing slip. And when I save and edit routing slip, we can scroll down and see where I've entered the monkeypox code. Now that my doctor, if he has a test for that, he can enter that information. The same exact thing applies if you want to delete something. So if you do not want your code to appear, you go to the administrative menu. I am going to go in now and remove that monkeypox. And I'm also going to go in and remove the code for the digital E&M. And you will see that it then does disappear from our patient's Superbill, from the Superbill that is the doctor that he can charge for. So again, I'm going to just go into an encounter just to edit the routing slip to see. I'm going to select done, save and edit routing slip. And if you scroll down, we no longer see my digital E&M code because we've deleted it. And we no longer see that monkeypox code over here. So remember, when you're adding stuff administratively, you are adding that so everyone can be using those functions to change it. Every single Superbill in the EHR now will have all the new codes that you have added as the administrator. Some other functions you may be performing as an administrator is adding new diagnosis codes to the system. Keep in mind, a diagnosis is required in order for a doctor to bill for a procedure. However, the codes are entered separately if you are working with a doctor who does not perform the procedure outside of the doctor's office, or if you're adding a diagnosis to the actual EHR. So this first administrative function I showed you with the Superbill, this is in the doctor's office, things he could bill for, procedures he performs in his actual office that he could charge the patient for. However, if the doctor needs to send the patient to get a test done, and that is a test he often does send a patient for, but he does not perform it in his office, then you will need to put that procedure in a different section. This will not be entered on his Superbill, but will be in the system so the doctor can order the test and send the patient to another facility so that they can then get the test done. It will not appear on the doctor's Superbill, but it will appear in the patient's information as a test that was ordered. The doctor won't be able to bill for it, but the facility he's sending them to will have the proper code to bill after the patient comes and gets the test performed. So this test that we're entering now is going to be a new procedure for a patient that is not in the doctor's office. So let's just say the doctor does not perform any sort of testing in his office, but he needs to send a patient for testing. So just for the sake of this code, I'm going to put in, it is an immunization procedure. I am going to put the code in as 0000. And I'm actually just going to put COVID vaccine so that way we can see it. So we may be ordering a COVID vaccine for the patient. We might not do it in our office, but we are going to send a patient somewhere else, but ensuring they have the right code on their paperwork so that facility knows what test to perform for the patient. So we are going to have to enter a code and a procedure name. So I put it in the wrong section there and it notified me of that. So the procedure name is going to be COVID vaccine. And I'm going to put in just a basic 000 just so we can enter it. But remember, you're going to have a document, as I showed you earlier, where you can put that vaccine CPT code in. And I'm going to save. Now, remember, our first procedure was the administrative down to the Superbill. And that administrative down to the Superbill is what the doctor performs in his office, the codes we want to appear on his Superbill, his or her Superbill, so that they can bill in their office. This procedure is for sending a patient out to another facility, and that facility will be performing the procedure, and that is under the new down to procedure tab. Once we enter our procedure for our patients going to another facility, we need to ensure if our doctor is ordering a test that it appears in our procedure order window. So I'm going to go in the new office visit and I'm going to go to procedures to see if my COVID vaccine is actually in there. And as you see, my COVID vaccine is here. My doctor would be able to select it and order the COVID vaccine and select done. We are going to skip billing in this instance because we are not allowed to bill. As you can see in the bottom right, it shows COVID vaccine. So the doctor has ordered the patient to go to a facility that will cover this test, and the patient will then take this document. There's a printout. You can print at the bottom with them, and it will have the COVID vaccine test on there with the COVID vaccine number. The patient then will go to the facility and get that test done. So make sure you know as an administrator that you know if it is a procedure that your doctor is performing in-house in their facility, you will need to go to administration and Superbill. If it is another facility that the patient has to go to because the doctor cannot bill because the other facility is performing the procedure, then you will enter that procedure under new and down to patient procedure. The last thing I'm going to be telling you about today in terms of a patient is entering those new diagnoses into the database as well. If you want to know how much medical records administrators are paid, hang in there. I will be going to a few websites so you can look at some of those descriptions for jobs and find out some of those responsibilities of a medical records administrator. Keep in mind that they will be different for every job, so I do encourage you to read all of the descriptions of every job. No one medical records administrator job is the same, but knowing the general tasks and what you need to be responsible for are key. So hang in there for this video if you want to know more about those salaries as I show you this last step for entering the patient's diagnosis. Diagnoses are entered the same whether the patient is in the doctor's office or somewhere else, because diagnoses are what the patient is being treated with. So your diagnoses codes are going to be ICD-10 or ICD-9, International Classification for Diseases. So these are going to be codes that the doctor is going to use to describe what is going on with the patient. The patient has a cough. The patient had a headache. The patient was diagnosed with COVID-19. So I'm going to go back and refer to the document we looked at earlier that you might get from your compliance team, and you would be responsible for entering these diagnoses. And I'll show you how these diagnoses do appear in your medical record. Here on our screen, you will see that we have some ICD-10-CM. We have some diagnosis codes that we have here that are going to be in use. Remember, every office is going to have different provisions, but the administrator job is sort of kind of done in a similar process where you go. You're going to be responsible for those new codes, those new updates, new rules and laws that need to be looked into. So here we have our ICD-10 CM codes, and these ICD-10 or 9 codes, depending on what code your office uses. Some are still using 9 and have to translate them into 10. We even have ICD-11 out already. So keep in mind, you're going to work with the workflow of your office. As an administrator, this bronchitis code J20.8 has to go into the database for your diagnoses. Bronchitis not specified as acute or chronic will go into your computer as J40 for your diagnosis codes. So I'm going to put in bronchitis non-specified at J40, and I'm going to show you where that code goes in your database. So as we're looking at our new diagnosis tab, we are going to go in and I'm going to name bronchitis chronic and it was non-specified. And we have our J40 code. And we're going to save. So now when we get a patient's chart in the new office visit or encounter, when the doctor is typing in the diagnosis for the patient, or you as the medical records person is responsible for entering the diagnosis from the medical record, you will be able to go in and search the codes that you put in for your diagnosis codes. As you can see, we have bronchitis 490. We also have bronchitis non-specified, which is the J40 I just selected. This can also be used the opposite way. If you have a code, but not the term, you can also look up the code and it will bring up that diagnosis there. So if the doctor has this bronchitis non-specified, it's not acute or chronic, we're not sure, that is something you can add to the database. So remember, some of our codes are entered because the doctor can bill for them in his office because he performs them in his office. That would be under administration and filling in those codes on the Superbill. If the doctor wants to send the patient to another facility, but he needs to order the test so the patient can get it done, new down to procedure, and you're going to enter those procedures based on what procedure you're sending your patient for outside of your facility. And for the doctor to be able to select any new diagnoses that are out there for medical conditions, you as the medical administrator will go to new and down to diagnoses and enter the new diagnosis as we had did earlier. Remember, there are many different things our medical records administrators can do. So now we're going to look at some of those descriptions. And I know what you've been waiting for. How much do they get paid? So we are here looking at medical records administrator. There are tons of medical records administrator jobs out there, considering we have lots of veterans, military records, a lot of pandemic records, and of course, records that need to be transferred from paper to electronic from all other medical conditions, heart conditions, cancer, immunizations, vaccinations, and all of that. So, lots and lots of medical records that actually need to have an administrator, someone who's going to be that point person to assist in ensuring that the proper codes exist in the computer, proper documents that the patient needs are in the patient's file, and maybe you be training and or attending to a team for as an administrator or working individually. It really does depend on your job description. So, for this particular job description, we can see that this manages records and a business office. This particular one is in Boston, but because this is the VA, Veterans Administration, they have jobs all over in multiple states for medical records administrators. So it says here the job is open to the public. And what are some of those duties? So, working in health information management, you may be training HIM staff or other clinical administrative staff in topics. What types of topics? In the health record, in the computer assisted coding area, that's the area that we were just in, the computer assisted area where we could do codes, computer assisted coding, or coding via computer or data entry. We were able to enter those new codes and update them so things could be corrected. You're going to serve as the point of contact person for health records corrections. So if some codes are not coming up properly, maybe the old code wasn't put in, maybe the old code is invalid and a new code needs to be put in. Maybe one of your staff that was assigned with helping with the task entered the code in the wrong window, and you need to direct them how to correct those issues, either by going to the administrative tab and going to the Superbill, or going to the new tab where the new codes are entered. So it really will depend on what your job is. So you may review and test and troubleshoot some of those menus and functions that we talked about. Sometimes they update software and they just don't work. And instead of everyone just kind of saying, oh, they don't work and just kind of bypassing it and figuring out another way to do it, you as the administrator would be the person that people come to and say, hey, this isn't working. I'm not sure what's going on. And then you would then take that information to the IT or the manager. Some of the qualifications are that you have knowledge of medical terminology, maybe with some records preparation, you've taken a medical office class, maybe you were an x-ray technician or a medical assistant or a nurse, and you've worked with a lot of these records before and you want to work with them now. One of the things I really like to show here for the government's websites is abilities and knowledge. If you have any medical terminology background, legal terms like your HIPAA forms, your protected health information, your notice of privacy practices, this may be a job for you. Performing and developing and implementing those legal laws and rules and regulations like HIPAA while maintaining patient privacy. So this one section to me is very important. So educational degrees recognized. If you are from a foreign education, you can actually send in your requirements, a certificate of equivalency, and they will evaluate your education for hire as well. So to ensure that they're complying with any kind of regulations, they do have to tell you for this particular job that you will require full vaccination for this job. Some jobs do not require this. At the time, it says the VA job announcement includes language that applicants to be fully vaccinated by executive order, but this requirement does not currently apply to this job announcement. So, looking at some of these jobs, a lot of the administrative jobs, a lot of the jobs that require documents and paperwork, you are performing in a secure location, hybrid in office, or potentially working from home. How will you be evaluated? This section is so important. In describing your experience, be clear and specific. We make no assumptions regarding your experience, so you need to include supporting documentation. Simply sending in your resume and telling an employer, hey, I just want this job. I took a course, or I used to be a nurse and I want this job. They're not going to know how to associate your experience. What does the government say is valuable experience? Experience refers to paid and unpaid experience involving volunteer work done through the National Guard. Maybe you've worked with a philanthropic, a professional, a community, a religious, a student, or social group. If you've worked in volunteering, it even says here volunteer work helps build critical competencies, knowledge, and skills that can provide valuable training and experience that translates directly into paid employment. So, if you are looking for a job and you know you have some bookkeeping experience, document review, organizing in any of these organizations, please put it on your resume. It is very, very valuable to organizations like the Department of Veteran Affairs. So this is a medical records administrator, and we're going to take a look at these salaries. As you can see, it is a very, very great lucrative salary for working as a medical records administrator. Let them know all of the key experience you have, paid or non-paid, community organization, a religious organization, a social group. All of that work is valuable. So make sure you put that in there to increase your salary in these areas. We're going to take another look too at another place where you can look and research jobs other than usajobs.gov, as this is usajobs.gov we're looking at right now. We're going to look at some other places that you can go and search for medical records administrator jobs. Here are some other titles you may see in medical records administrator. You may see medical records manager, or a senior or lead position in health information technology. That is going to be specific to a job, and you would need to read the description. So as you can see, the national average for management or for a clerk is in the $53,000 an hour range for not much experience. Let's click on what one of these specialists would do. I'm trying to find one that's more of a coordinator, or one that is a management position. So we have this one as a manager position. And you would be responsible for planning, organizing, and influencing department activities. So, as I mentioned previously, and this one looks like it's a fairly newer job, just posted recently, a full-time position. Effectively interacts with patients and significant others and members of the team for this particular job. Must be knowledgeable of health information technology, knowledge of your CPT codes, and successful completion of a course that has anatomy, physiology, med term, and CPT. You may have a certification or a license from one of these agencies. If it's not one of these and you have another certification, that is fine. Let them know. Sometimes they just list the basics. If they only want this one, sometimes they will say, we will only accept this particular cert. Also, you have to become proficient in how they run their Epic. And as it says, coding modules as required within 90 days of hire. So you're going to have to complete their coding modules as part of your paid training and complete that within a required amount of time. Looks like a really great job there. There are many jobs for medical records managers. I'm actually going to put administrator in here and see if it populates anything else. And it does. It pops up other jobs in the administrative title. So you might be looking at administrative documentation in a surgical center, and you have to gather those documents and be the one that actually is responsible for helping out that department. Health services administrator, again, you're going to be evaluating how those codes come up. If the information in the patient's record comes up properly, and if it doesn't, you're going to be the one responsible for assisting others in the staff or assisting them in making particular corrections. This one in particular is looking for a nurse for this one, which makes sense because it's for all of their health services. So be sure if you're going to glassdoor.com that you are looking in your general area. As I've changed the search to my area, it does change to about $61,000 and talks about how much they typically make. There are some recent salaries reported that are kind of all over depending on what your basic responsibilities are. We have medical coders, EMR analysts, medical records analysts. We have some jobs, $15 an hour. That's about a year's experience, but $21 an hour we have here. We have an EMR analyst that is $99,000. Coding specialist, $26 an hour, medical biller, because sometimes it may be in that general area of that type of job. You will also see some companies that are hiring and what people are saying about certain salaries and jobs as well, too. You can then go into careers and discover what careers are out there based on different types of jobs that you're looking for. So if you're really looking for that medical administrative job or medical records job, make sure you look for that. You want to be sure that you're paid what you're worth by looking up the information in the salaries tab. Very, very important. So just as a quick refresher and review, everyone, as an administrator, your major functions are going to be to make sure those laws and regulations are followed. You are protecting patient information, and the right codes can either appear in our database to send our patient out to get a procedure elsewhere, or our diagnoses need to be in our database so our patient can actually have a diagnosis assigned by the doctor, or you're going down to the administration functions to our Superbill, and based on the guidance from the compliance team or health information technology team, you will be tasked with entering new labs, new codes, new tests that your doctor performs. Again, those new procedures for outpatient are done in the new menu down to procedure. And the test that our doctor performs in his office will be on his Superbill. So hopefully you've learned a little bit more about medical records, the expansive field, the variety of jobs that are out there, and the key salaries that you may see in the field. Hopefully you've learned a lot from me with the medical records administrator. Make sure you go to usajobs.gov and go to Glassdoor. I will put those links in the comments and the description so you could go right there and start searching and researching for some of these amazing jobs. My name is Carla at Carla's Career Shortcuts and Coaching. I hope you've learned a lot from this video today. Make sure you like, subscribe, and comment. Share my videos with anyone who you think this may help, who's looking for a new career as a medical records coordinator. My name is Carla. Have a great day, everybody, and take care.